My name is Cynthia Linville, and today I am going to present to you all the information regarding my business, Five Corners Practice Services, LLC. Five Corners is the premier complete practice management services in this 5-state region. This includes Southeast Missouri, Southern Illinois, Western Kentucky, Western Tennessee, and Northeast Arkansas. With this presentation, we are looking for investors to raise $50,000 to build an office on our property and to purchase a dedicated server. With the changes that have happened in healthcare over the last few years, especially with the passing of the Affordable Care Act, many practitioners now have doubled their workload and some have even tripled. Since Obamacare has become a reality, Five Corners has the expertise to manage billing, coding, scheduling, compliance regulations, and the quality assurance responsibilities for every practice. Five Corners has been in business since 2011, and we started with one chiropractor, and now we have 5 practitioners. Unfortunately, in today's healthcare industry, the majority of the practitioners have become part of the big business of healthcare. To the big for-profit firms, the patient is a number, and the number means dollars. However, there are still practitioners who believe that patient-focused care should be a priority. I want you to take a moment and think about the last time you were in a physician's office. How long were you in the office? How long did your doctor spend with you? 5 minutes, 3 minutes, came in, listened to your heart, went back out. The problems, these patients, that's not fair to us as the patient, that's not fair to us. We believe that the patient should come first. The big business healthcare firms are not only concerned about their bottom line. Taking care of patients takes caring, compassion, love, and understanding. It's time for the healthcare industry to have patient care as their primary focus. The healthcare industry needs to change. The purpose of Five Corners philosophy is to allow the practitioners and their staff members to focus on patient care. We want the patient to be first. We at Five Corners believe that the medical industry's focus needs to revert back to patient-focused care. The Centers for Medicare and Medicaid have begun to focus on equal treatment for their patients. Of course, CMS's main goal is to save money, but at the same time, their goal is to establish equality in the care that is provided to the patients that they insure. In the 18 counties that make up Southeast Missouri alone, there are 1,072 physicians, and this was pulled off of the 2009 census. In Butler County, there are 9 chiropractors and approximately 20 dentists. Of these 1,072 physicians, they service approximately 385,000 individuals. Of the chiropractors in the Poplar Bluff area, just one of the practitioners averages 150 patients a week, making 600 patients a month. Since Five Corners has been in operation since 2011, we have established 6 clients. We ended 2014 with a gross revenue of $48,360. We ended our year with a profit of $2,168. What makes Five Corners different from the local competition? I have over 21 years of experience in the medical industry, with over 6 in building and coding alone. I received my national certification as a certified coding specialist in November of 2014, and in May I received my chiropractic specialist. This will be appealing to all providers, as certifications are respected within the medical industry. We have also contracted with a retired RN who will be able to answer any questions if our physician is unable and is not readily available. We also have contracted with a retired medical doctor who has agreed to be available for the company if the ordering physician is not available. Five Corners employees combined have over 75 years of experience in the medical industry. We are flexible and have the ability to provide sufficient time to each practice. We are extremely thorough and will do everything possible to recoup all unpaid and or denied claims. We believe that the patients come first. We take care of the paperwork, the financials, and the medical records for the clinic. We also provide daily, weekly, and yearly reports to the practitioners. As I mentioned earlier, Five Corners began its initial marketing to the 18 counties that make up Southeast Missouri. With over 1,000 physicians servicing over 384,000 people, our customer base is very large. During the fourth quarter of 2014, Five Corners completed a market research survey. We conducted interviews by phone and through emails. We received 4 survey responses and successfully completed 11 phone interviews. Our focus group included office managers, doctors, and office staff. Our most important survey question pertained to the time their staff spent billing. 81% of the survey respondents did somewhat agree that their staff is spending over 50% of their time in billing manually or through electronic clearinghouses. Five Corners, we can take over that responsibility. Five Corners can take care of the billing, which in turn will provide more productive time for the staff to concentrate on patient care. The respondents agree that their claims are processed in a timely manner. However, they have found that their documentation is lacking. Five Corners verifies the documentation and makes sure that the claim, prior to the claim being submitted, has the appropriate CPT codes, the appropriate diagnosis codes, and that there is no billing left on the table. After comparing the surveys, the majority of the respondents are all having the same issue. Five Corners currently provides billing services to 5 clients and complete medical practice service to 1. As of the end of June, all 6 clients have signed contracts, which will expire on July 31st, 2018. Five Corners is a full practice management service provider, which includes billing, coding, and all other aspects of management. Currently, the healthcare industry is going through major changes. Many of the changes are due to the Affordable Health Care Act, as I said earlier, and Five Corners has the experience and the training to assist practitioners in coping with the new regulations. Another huge change is occurring on October 1st, 2015. This is when ICD-9 codes will no longer be accepted and ICD-10 codes are going to be the thing. However, many practices are not prepared for this because it is such a change. We are changing from, in the chiropractic industry alone, we're changing from 6 codes to 263 codes. Five Corners has recently also added a new service which we call Startup. Startup is developed to help a practitioner, either they're moving or it's a new grad and they want to start their own practice. And what we can do is we actually can help them go all the way. Over the last 6 months, at the end of every 6 months, we meet with our clients and we do a evaluation, not just of their billing, but also of ourselves. In December, one of our single practitioners stated to me, "I am so pleased with the service and dedication that y'all have given us and your staff provide to my office, not only do I have more time to spend with each patient, but my revenue has also increased. I am no longer having to pay overtime for my staff, and my staff is a lot happier. We even help patients with questions. In February, one of the practitioner's patients was dealing with the affordable health care. They were trying to get a plan. They were having a terrible difficulty. The practitioner called me up, and I made an appointment to meet with the patient at the practitioner's office, and we were able to complete her health care. She now has insurance, and 2 weeks later she sent me a bouquet of flowers because she was so happy that she got her insurance when she had had such a nightmare, and affordable care can be a nightmare. Five Corners is still in the growth stage. However, we're growing out of our current dedicated office space, which is in my home. We are maximizing our space, but the time to increase our work area is growing near. We are constantly recruiting new clients so we can build our business. Over the next 2 years, our expected gross revenue is approximately $90,000 respectively. Our goal is to add a minimum of 6 clients and to meet a 4.5% increase. We believe with our current space we can handle the 4 more clients. However, we will be wall to wall. This is why we are looking for investors who are willing to grow with us. Five Corners has developed specific procedures for both startup and for our billing service. Each procedure is detailed but also flexible enough to fit into any clinic setting. You might ask yourself, how do they do what they do? Collectively, the employees of Five Corners have over 75 years of experience. We are proud of our flexibility we can offer our practitioners and their staff. We are dedicated to increasing the practitioner's quality time with their patient, and we are utilizing the current software that the practitioner has. This saves us money without having to buy their software, and also it saves the practice money so they don't have to buy any software. We also encrypt everything that comes in our office and out of our office. Each document that is imported or exported is encrypted through CryptoForge. We have a security system that monitors visual and audio, as well as an alarm system that records who comes in and out of the office. During off hours, the security system is monitored by a third party. Five Corners offers competitive advantages over other medical billing services. We do more than just billing. We provide complete practice compliance audits. We do risk analysis, quality assurance measures, and we do coding verification. We provide a high quality of expertise by having an RN and an ND on staff. We have advanced customer service skills. We are also a home-based business, which will keep our overhead low, where we can actually pass that on to our practitioners. Like any other entity that deals with private health information, Five Corners must maintain HIPAA compliance. Five Corners documents have strict procedural documents and a compliance manual. We have signed HIPAA documents with all of our clients, employees, suppliers, and vendors who may come in contact with any of our personal health information. Keeping our clients' information is as important as our customer service. Five Corners has also delivered a risk analysis assessment policies that are reviewed monthly. If Five Corners were to suffer a breach of any type, our risk analysis assessment procedure provides step-by-step details as to what has to happen in case of a fallout. Five Corners has a simple pricing structure. We keep our overhead low and we pass on the savings. We invoice for 3% of all collected invoiced revenue. A 4%, we invoice 4% if the revenue is collected from an appeal or a redetermination. And we charge $15 an hour if we provide management or quality assurance compliance services to the office. We also have a guarantee. During the contract negotiation, percentage of revenue is decided upon as to how much will be collected every month. If the determined amount is not generated by the fourth month of billing, 1.5% of the collection will be returned back to the petitioner. If it's an appeal or a redetermination, it will be 1%. If it is a delay due to a complication through the insurance company or through Medicare, there is no reimbursement. Five Corners has a simple pricing structure. We are able to keep, our team. Our staff consists of 5 individuals. Ike, who is our medical director, he is a retired urologist who specializes in coding. Lois, who is a retired RN, she was an RN for 57 years, she's our medical liaison. Me, I'm the certified professional coder, and I'm one of the owners of the business with my husband, Mike. Carrie and Mike are data entry. The sales for the first year reflect a total of $41,404 with a total margin of $36,641. The sales forecast percentage is 4.5, and we strive to make above the 4.5. Year two and year three, we have an increase in year 2, not much, but it's a little, and then we have a total margin on year 3. We have an increase, but our cash flow is negative. That is another reason we're looking for investors. The income statement is a comparison between years 1, 2, and 3, and we have increased growth. Our operating expenses for year 2 are expected to be $49,533, and year 3 will be $54,026. However, the owners have discussed actually doing away with the data entry positions because they are a huge expense to the company. We are looking into that. Five Corners is not going to make the owners wealthy. However, the owners are very dedicated to keeping the company solvent. With the first year having a profit, we added 5 new clients is a huge positive. Five Corners must continue to actively recruit more clients. If the company remains with the current client base, year 3 we will have a negative. If Five Corners can find investors, the company will be moving out of its in-home office space to a small building that we will construct on our property. And we will have a dedicated server, so we won't have to buy individual computers for each client. As far as employees are concerned, if the company added 5 more employees by the end of year 3, this would cause the company to be insolvent. If the company would not remain open. In other words, adding more employees would be a very poor business decision. The 3-year outlook is exciting, and as healthcare continues to change, Five Corners is ready to change and improve its service as the needs of its practitioners change.